Hello everyone, welcome back to the rationalization for the MTAP post-test in hematology. And in the previous video, we were able to discuss the answers for the first 30 questions. And upon checking, medyo napababad pala tayo no, dun sa ating first video. Don't worry, I will try to make it a bit faster for the next for the remaining questions. Okay? Sige, so let us now proceed with number 31. It says here, using the test to measure D-dimer, which test results would be indicative of a patient having DIC. Okay, ano muna yung DIC? Again, DIC is the disseminated intravascular coagulation wherein there is widespread activation of your hemostasis or coagulation. DIC actually has two phases. Since ang meaning nga po niya is disseminated intravascular coagulation, ang first phase niya is thrombosis kasi nag-activate yung coagulation, nagpo-form tayo ng clots. But due to the excessive formation of clot, nagkakos din siya ng depletion. Okay, ng depletion ng ating mga ingredients. Ano yung mga ingredients natin? Yung platelets natin, tsaka yung coagulation factors natin. In short, kapag nasa DIC, kapag ang person or ang patient ay merong DIC, the laboratory results that we would observe in these patients are everything is abnormal. So, abnormal platelet count, abnormal coagulation tests, and abnormal D-dimer units. So, ano yung D-dimer? D-dimer is yung, it is a fibrin degradation product, and it is increased or abnormal in DIC because if there is many clots being formed, there are also many clots being hydrolyzed. And so, there will also be many fibrin degradation products. Okay. Having said that, ano yung pattern, no? Ano yung mga results dito sa ating choices na aligned doon sa sinabi natin na everything is abnormal? Number 1, for D-dimer muna, the reference range for D-dimer is less than 500 nanograms per ml. So, less than 500 yung normal. So, hahanapin lang natin kung sino yung mas mataas sa 500. And in our choices, eliminated na agad yung C and D kasi normal pa yung D-dimer niya. So, A and B na lang tayo. Okay, in letter A, nakalagay dito, increased PT and APTT, decreased platelet count. Tapos sa letter B naman, decreased PT and APTT and increased platelet count. Ano nga yung sabi natin? Everything is abnormal. Kaso, pareha silang abnormal. Pero ano yung mas tamang abnormal? No? In DICC, what happens what happens again? There is widespread activation of hemostasis leading to the depletion of our hemostatic cells and protein. So, depletion meaning nauubos. For platelet count, ano yung depleted? Syempre yung decreased. For PT and APTT, wag po tayong malilito, hindi po decreased yung hinahanap natin. Kasi, ano ba nangyayari kapag nawawala or nagiging deficient yung mga coagulation factors, di ba? Nagpo-prolong yung PT and APTT. So, the correct term or the correct abnormal result would be increased. So, increased or prolonged PT and APTT and decreased platelet count due to the depleted platelets and depleted coagulation factors happening in disseminated intravascular coagulation. So the answer here is letter A. Next, the factor with the longest half-life, medyo memorization lang to, so sagutin na lang natin. The answer is letter A, factor 2. Ang gusto ko na lang na matandaan nyo for this one would be factors 5 and factors 8 are considered as labile factors. Ayan. They are considered labile factors. O, yun lang. Pero among dun sa mga remaining choices natin, 7, 10, and 2, the one with the longest half-life is factor 2. Number 33, if a patient has prolonged PT, the patient is most likely deficient in, okay, Sabi dito, prolonged PT. Hindi niya binanggit yung APTT, so I will assume the result for that is normal. Kapag PT, what are the pathways that what pathways can it evaluate? Syempre, yung ating extrinsic and common. Alin ba dito yung no, before that, since normal si APTT, most likely, eliminated na po yung common. Kasi kung common yung reason, dapat lalagay din niya dito prolonged APTT. But dahil PT lang po yung prolonged, we can assume na the missing factor belongs to the extrinsic pathway. And from here, what are the pathways of each factor? 8 is intrinsic, 2 is common, 7 is extrinsic, and 10 is common. Therefore, the answer for this one would be letter C, 7. Next, if a patient has just a prolonged APTT, okay, just yun lang daw, just a prolonged APTT, so we will assume na the missing factor is intrinsic lang. Kasi kung common yan, dapat sasabihin niya prolonged APTT and prolonged PT. Pero dahil prolonged APTT lang, ang factor natin ay nasa intrinsic pathway lang. So, if a patient has prolonged APTT, the patient may be deficient in the following factors. So, hanapin lang natin. 8, check. 10, 2, 1, o lahat to common. So, X na yan. 8, 9, 11, 12, lahat po sila intrinsic. 8, 10, 11, 11, ano kaya to? Okay. And then, 8, 11, 2, 12. So, 2 is common, eliminated na po siya. 10 is common, eliminated. But this one, 8, 9, 11, 12, all of them are in the intrinsic pathway. So, letter B po ang answer. 35. The factor that is responsible for stabilizing a soluble fibrin monomer into an insoluble clot has, we mentioned this in the first video. This is actually factor 13, di ba? Factor 13. Anong sagot dyan? The answer would be normal PT and normal PTT. Letter D. Kasi, ano yung sabi natin sa factor 13? It cannot be evaluated by your PT and PTT. But what is the test that can evaluate factor 13? Nasabi ko ba yun? Parang hindi pa. So, what is the test? Dahil hindi siya kayang i-evaluate ng PT and PTT, what is the test that can evaluate factor 13? It is urea solubility test. Okay? Urea solubility test. Ito po yung test na nakakapag-evaluate ng factor 13 deficiency. Okay, 36. An inhibitor of plasmin activity is... Okay, so in fibrinolysis, we have many regulators, right? But the inhibitor or regulator that inhibits plasmin, yung activated na siya, would be letter C, alpha-2 antiplasmin. Okay, ano yung PAI1? PAI1 is plasminogen activator inhibitor, meaning ang mechanism niya is to inhibit the activator, which is your TPA or tissue plasminogen activator. Yung plasminogen, ano naman to? This is the precursor of your plasmin. Okay, so important po na alamin kung ano yung difference ng PI1, which inhibits the activator, and the alpha-2 antiplasmin, which inhibits the plasmin itself. Okay, don't forget that. 37 na po tayo. Which of the clotting factors is not a protease? Diba, meron tayong mga sinagot in the previous video na cellular protease or serine protease, and we mentioned there that majority of the factors are proteases except for the cofactors and our actually factor 13, which is a transglutaminase. So connect na lang po natin yun. I think that is question 23. We talked about serine proteases there. And in this question, okay, the answer here would be factor 30. Oops, ano nangyari? And factor 13. Ayan, letter C. Why is factor 13 not a serine protease? Because it is a transglutaminase. Paano i-spell yun, no? Ayan, transglutaminase po siya. So, 2, 7, and 9 are all serine proteases. Next, key roles of thrombin with respect to fibrinogen. Okay, key role of thrombin with respect to fibrinogen. Anong ginagawa niya? So, I'll go straight kasi feeling ko dapat alam niyo to. Thrombin converts your fibrinogen to fibrin. So, letter C. Okay, did you know that thrombin does not only activate fibrinogen, but it actually activates all of the factors in our fibrinogen group. So, sino nga ulit yung nasa fibrinogen group natin? C1, C5, C8, and C13. Okay. O, diba? Fun fact. May ilagay nyo na yun sa notes nyo. All members of the fibrinogen group in question number 1 are activated by thrombin. Okay? Are activated by thrombin. Here we can see that that statement is seen in letter D, but this cannot be the answer because the question was very specific. Dun lang po sa fibrinogen yung hinihingi niya. So, ang best answer for this question would be letter C. Okay, number 39, which of the following laboratory assays will be normal in a patient with dysfibrinogenemia? Ano nga po ulit yung dysfibrinogenemia? It is when the fibrinogen is present but they are pangit or substandard or dysfunctional. Okay, for the tests that you see here, hahanapin daw natin yung hindi nakaka-detect ng dysfibrinogenemia. Okay, for reptilase time, this is a test for fibrinogen, diba? And thrombin time, we already differentiated the two. And they can detect dysfibrinogenemia because if the fibrinogen is non-functional or dysfunctional, it will still not be able to form the clot na hinahanap natin sa ating test. So, kasama sila or they can detect this fibrinogenemia. For PT and PTT, ganun din po because even if fibrinogen is there, if it is dysfunctional or abnormal in function, the clot that is the end product, okay, that we want for PT and PTT will not be formed. So yes, kasama po sila. How about for immunologic assay for fibrinogen? Usually, for immunoassays for fibrinogen, they only detect the presence but they don't measure the function. Meaning, as long as nakakabind sila dun sa fibrinogen at nadedetect nila yung quantity niya, okay lang siya. Okay? So again, immunoassays are mostly quantitative lang pa or they just detect presence or absence but they cannot detect or they cannot evaluate the function. Okay, since ang question po natin ay sino daw yung magiging normal lang, KEBS lang, no? Hindi siya sensitive sa mga abnormal function ng fibrinogen, the answer for that would be letter A, immunologic assay for fibrinogen. Next, number 40 na po tayo. Primary purpose of the fibrinolytic system. Okay, diretsohin na po natin. The answer is letter C. What happens nga in fibrinolysis? The fibrin clot is hydrolyzed by plasmin to your fibrin degradation products. And bakit kailangan nating i-hydrolyze yung ating fibrin clot? Para ma-break down sila at para hindi sila bumara sa ating mga blood vessels at hindi po sila mag-cause ng ischemia or ng embolism. Kaya, yun, to restore blood flow at the local level. So, letter C po yung answer dyan. Okay, number 41. The primary inhibitor of the fibrinolytic system is, answer is letter A. Okay? Protein S and protein C are for secondary hemostasis. They are regulators of secondary hemostasis. Antithrombin also. Okay, kinakalaban niya si thrombin na nasa secondary hemostasis. So, lahat sila eliminated. Ang natitira na lang po would be antiplasmin. Okay, 42. Dilute Russell's Viper venom test is helpful in the diagnosis of? Okay, the answer for this would be lupus anticoagulant. Medyo memorization lang to guys. Basta tandaan nyo, pag nakita nyo yung word na dilute Russell's Viper Venom test, automatic siya. It is for lupus anticoagulant. Paano kapag hindi dilute, no? Pag ano lang, Russell's Viper Venom test lang. So this is actually a test for your common pathway. And the other name for this one is the Stipven time. Okay? So originally, this is a test for the common pathway, meaning yung ating 1, 2, 5, 10. But if you dilute this procedure or you dilute the reagent, ayan. If you dilute this procedure, it will not be sensitive anymore. Okay, it will not be sensitive anymore for the deficiency for detecting or in detecting the deficiency of your coagulation factors, but it will remain sensitive in detecting your circulating inhibitors or circulating lupus anticoagulant. Kaya kapag dilute Russell's Viper Venom test, it is indicated for detecting lupus anticoagulant. What is lupus anticoagulant? So lupus anticoagulant is actually associated with what you call the antiphospholipid syndrome. Ayan, wherein it is an antibody against the phospholipids. Phospholipids in your body. And I'm not sure, nasabi ko na ba to before, but sa lupus anticoagulant, in vivo, okay, in vivo, it is actually a risk for thrombosis, pero in vitro, or when we evaluate them in the laboratory, it prolongs your PT and PTT. Okay, parang yun natatandaan ko na sinabi natin na yung lupus anticoagulant, nagpo-prolong po siya ng PT and PTT. So nakaka-interfere po siya no, sa ating coagulation testing. Okay, so lagi nyo lang tandaan kapag lupus anticoagulant in vivo or inside the body, it is actually a risk for thrombosis, but in vitro, what it does is that it interferes with our coagulation testing, prolonging the result. Okay, number 43. The lupus anticoagulant is directed against, okay, sabi nga natin, it is involved in the antiphospholipid syndrome, which attacks the phospholipids inside the body. So, ganun din po, when we perform our coagulation testing, like PT and PTT, because we use phospholipids there, di ba yung reagent natin, yung thromboplastin, di ba, na minention natin before, may mga phospholipid component yon. So, nagbabind siya doon para ma-prolong yung ating test or para hindi or para i-interfere yung ating test, causing a prolonged result. So, the answer for 43 is letter A, phospholipid-dependent coagulation tests. Okay, next is number 44. Which is true or which statement is or are true about protein C? Okay, for this one, medyo tricky po siya, no? Because, sige, protein C is a regulator of secondary hemostasis. It is actually an inhibitor of coagulation. And what it does is that it destroys factors 5A or yung activated factors 5 and 8. Okay, so bakit ko nasabing tricky siya? Kasi, so this one, it is a cofactor to protein S. Pwede tayong malito na ito yung isagot natin kasi magka-partner talaga silang dalawa. Pero medyo baliktad siya kasi dapat yung protein C yung main enzyme, tapos ang cofactor niya is protein S. So dapat protein S is a cofactor to protein C. So initially, parang pwedeng A and D yung sagot. No, but if we're going to be strict in this question, the protein S should be the cofactor. So I think the best answer for number 44 is letter D. It is a physiological inhibitor of coagulation. So how does it inhibit coagulation by destroying factors 5 and 8. So, wag na lang po malilito because between protein C and protein S, dapat yung protein S yung cofactor natin. Okay, 45. Activated protein C resistance is associated with, okay, since ang protein C ang target natin ay 5 and 8, okay, so dapat ang pagpipilian na lang natin ay A and D. A and C. A and C. However, between the two, yung known mutation that really leads to activated protein C resistance is yung ating factor 5. And this is also known as your Leiden. 46, thrombin thrombomodulin complex is necessary for the activation of protein C. Okay. So, pag-connect na lang natin yung tatlong questions natin. So, thrombin thrombomodulin activates protein C, and protein C actually binds to a receptor in your vascular intima, the protein C, endothelial protein C receptor, and then once it binds there, it will destroy now your factors 5 and 8. So, yun yung story ni protein C, thus inhibiting, further coagulation. Okay. 47, correct statement regarding lupus inhibitors. Okay, so sabi natin dun sa previous video, sa lupus inhibitors, everything is abnormal. Nasabi ko na ba yun? O if not, okay, sa lupus inhibitors natin or sa lupus anticoagulant, because it is not a missing factor, it's actually an additional something, no? An added interference in our specimen, okay, it is not corrected or it cannot be corrected by mixing studies. So, pag may nakita tayong questions about lupus inhibitors and you are being asked to compare different laboratory results, ang una niyong hahanapin is yung lahat abnormal. So, ano yung mga choices natin dito sa number 47? Prolonged APTT on undiluted plasma and mixed and 1:1 mix of patient plasma with normal plasma. Corrected. So, cannot be na yan. Normal, hindi nga po. Kasi interference nga po siya. And then, normal ulit, hindi pa din. So, the best answer for number 47 is letter A. And lagi niyong tatandaan, since this is an anticoagulant, okay, no matter how much plasma you mix with the specimen, as long as the anticoagulant is there, it will continue to interfere with your coagulation tests and it will continue to be prolonged or abnormal. So there is no correction in if there is lupus inhibitor. 48. What coagulation plasma protein should be assayed when platelets fail to aggregate properly? Okay, the answer for this will be letter B, fibrinogen. If you remember, sa primary hemostasis, okay, sa primary hemostasis natin, the link between two platelets is actually your fibrinogen. Ayan. In the same way, so this is for aggregation. In the same way, sa platelet adhesion naman, the link of your platelet to your exposed collagen or the carpet between the two is your von Willebrand factor. So, lagi nyo tatandaan yung von Willebrand factor for adhesion, fibrinogen for aggregation. Subendothelial structure protein triggers coagulation through the activation of factor 7. Okay. Ang tinatanong lang po dito is yung trigger ng ating extrinsic pathway. So, sa ating extrinsic pathway, sino nga yung namimit ni, or sino yung nag-activate kay factor 7? It is factor 3, also known as your tissue factor. And ano nga yung tissue factor natin? It is not circulating in the plasma, but instead, it is found in our damaged vascular intima, yung mga underlying tissues niya. And your smooth muscle cells, nakatago po sila doon. Okay? So, number 49, tissue factor. O, sagutin na lang natin yung iba. Thrombomodulin, it's also from your endothelial cells. They activate protein C. Nitric oxide, this is actually an anticoagulant. that prevents vasoconstriction. So, vasoconstriction is a response. Di ko na nasusulat na maayos. Ayun, it's actually a response in hemostasis. So, if nitric oxide is there, then vasoconstriction will not happen. Okay? Keeping the blood vessels, kalmado lang, no? And no hemostasis will occur. And then thrombin, alam na natin to, it converts your fibrinogen to fibrin. Number 50, we're already halfway. Kaya niyo yan. What is the primary role of vitamin K for the prothrombin group factors? Ayan, prothrombin group factors. Who are the members of this group? 2, 7, 9, and 10. And what does vitamin K do? It, diretso na tayo, no? Letter D, carboxylates the factors to allow calcium binding. If we will extend this description, what does it do? It performs gamma carboxylation. Yan, gamma carboxylation of our prothrombin group factors so that they can be functional, okay, so that they can bind to the calcium and so that they can effectively perform the or participate in the coagulation cascade. 51, source of prothrombin fragments 1 and 2. Okay. So, source of prothrombin fragments 1 and 2. Your prothrombin, okay, before it becomes thrombin, it needs to be cleaved. Okay, so yun po talaga yung nangyayari sa mga coagulation factors natin. When they are activated, so whenever you see the word activate, okay, the exact process that is happening there is that they are being cleaved by the, yung mga factors that came before them. So, for example, thrombin will cleave fibrinogen into fibrin. So, it will activate fibrinogen to fibrin. So, sino? Ang question lang nito, ang tinatanong lang niya is, what is the factor or what is the blank, no, that activates your prothrombin or that cleaves your prothrombin into fragments 1 and 2, becoming now your thrombin. So, ano po yung nag-activate sa kanya? So, among the choices, the answer will be, factor 10. So, proteolysis. Okay, lysis or cleaving of prothrombin by factor 10 or activated factor 10. Ano nga ulit yung nangyayari sa common pathway natin? So, si 10 will form a complex with 5. And then, they will activate 2. Okay, into 2A, and then 2A will activate 1 or fibrinogen into fibrin. So, anong sagot? EDC, factor 10A, letter C. 52, serine protease that forms a complex with factor 8A, when what is the substrate of this complex? Okay, factor 8A in the intrinsic pathway is actually a cofactor to factor 9. Okay. And together, what will they activate? They will activate factor 10. So, alin yan dito? So, we have, letter D. Okay, so factor 8 is a cofactor to factor 9. And together, they will activate factor 10. So, this is the substrate. Letter D for 52. 53. What protein secreted by endothelial cells activates fibrinolysis? Okay. Plasminogen, hindi ito kasi ito yung ina-activate. Okay. How about TPA? So, TPA is tissue plasminogen activator. Okay. So, does it satisfy the sentence here? What activates fibrinolysis? Yes. So, 53, the answer is letter B. Paano naman yung letter C? So, this is plasminogen activator inhibitor. So, it does not activate, it inhibits. So, hindi yan. And this one naman is the thrombin activatable fibrinolysis inhibitor. So, inhibitor, it does not satisfy our question. So, hindi din po yan ang sagot. So, okay. So, the answer is letter B, tissue plasminogen activator. Next, 54. So, I think I will stop at 60 and then I'll just upload a part 3 video, no? Okay. So, 54, two regulatory proteins form a complex that digests activated factors 5 and 8. Nasagot na natin yan kanina. The answer is letter C, APC or activated protein C, and its cofactor, protein S. 54 is letter C. 55, most coagulation factors are synthesized in the liver po. That is why in liver disease, the side effect of this is bleeding tendency, because if there is liver disease, we will lose the source for our clotting factors or majority of our clotting factors. Okay, so 55, the answer is A. 56, the events involved in secondary hemostasis. Okay, A, leads to the formation of stable fibrin clot? Yes. Okay. Occur independently? No. So always remember, secondary and primary hemostasis are interdependent. Occur in a random? Definitely not, because it needs to be triggered by either the exposure of the tissue factor or the exposure of or the contact of our collagen with our intrinsic or contact group, di ba? In the intrinsic pathway. First line of defense, not really. Kasi kaya nga tayo merong primary hemostasis. So, dito, the answer will be letter A, leads to the formation of a stable fibrin clot. 57. Which of the following coagulation factors is activated by thrombin and mediates the stabilization of the fibrin clot? Mediates a stabilization, that is factor 13. Ilang beses na natin na-discuss yan. 58. Which of the following endogenous plasma inhibitors are important for the control of excessive thrombin generation? Sino daw ang mag-i-inhibit ng excessive or magko-control ng excessive thrombin generation? Okay, so the answer for this one is letter A. Ayan. Antithrombin. Okay, so AT is antithrombin. From its name, very obvious na, no? Na ang gagawin niya ay i-inhibit ang thrombin generation. What is TFPI? TFPI is tissue factor pathway inhibitor. Okay, in the tissue factor pathway, it actually inhibits the extrinsic pathway, di ba? The activation of tissue factor, and then 7, and then 10, and then 2, right? So the end product of your tissue factor pathway is actually thrombin generation. So if you're going to inhibit that, okay, through tissue factor pathway inhibitor, edi we will be able to control excessive thrombin generation. What is platelet factor 4? Platelet factor 4 is it's actually a procoagulant, and what it does is that it neutralizes, okay? It neutralizes your heparin. So, actually, opposite na effect yung makukuha natin dito. So, hindi po yan. Okay, and then we have our thrombin, antithrombin complex. So, thrombin, antithrombin is a product of antithrombin. And then, your F1 plus 2 is actually your thrombin. And then, lastly, you have your A and B. So, definitely hindi na po A and B ang answer kasi platelet factor 4 is not the answer. So, between A and C, the best answer will be A kasi dito talaga sila nagsisimula sa antithrombin. TAT and F1 plus 2 are just related, no? Related steps to the regulation of thrombin generation. So, 58, letter A. 59. In most LAC profiles or lupus anticoagulant profiles, what test is performed first? Because it detects LAC with the least interference. The answer is B. Dilute Russell Viper Venom test. We already talked about this earlier. And what does this do nga? Kasi because the procedure is diluted, okay, it is not sensitive to coagulation factor deficiency anymore. So, yun yung interference na gusto sana nating tanggalin. So, if DRVVT is prolonged or abnormal, we can be assured that the reason for that will be your LAC and not coagulation factor deficiency. Ayun lang. So, DRVVT. And then last question for this video, and then I'll just cut it and then make a third video na lang po for the last 40 questions. An elevated level of what fibrinolytic system assay is associated with arterial thrombotic risk? Okay. An elevated level of what assay is associated with arterial thrombotic risk? Okay, eliminate muna natin yung factors 7A and factors 13 because they are not part of the fibrinolytic system. So it's just between A and B. Okay, but which of the two na kapag madami sila ay nagkakaroon ng risk for thrombosis? Meaning, pag dumadami sila, okay, na-maintain yung clot, hindi siya na lalyze. Yung activator ba ng fibrinolysis or yung inhibitor ng fibrinolysis? 5, 4, 3, 2, 1. Answer is letter A. If your inhibitor is elevated, then it will inhibit fibrinolysis and thus inhibit the breakdown of your fibrin clot. Thus, it will allow the clot to retain in your blood vessel and give you risk, no, for thrombosis or arterial thrombosis. So, letter A. Kapag TPA yung elevated, baliktad po yung effect niya. So, if there is elevated TPA, it will further encourage the fibrinolytic system at baka ang tendency pa nito is bleeding. Kasi hindi pa niya time, sinisira na agad niya yung clot. So, opposite yung effect po niya. Okay? So, number 60, the answer is letter A. Okay? So, I will stop the video again here. And in the third video, sana medyo napabilis ko ng konti, no, para di kayo mainip. But in the third video, tatapusin na po natin from 61 up to 100. Okay? So, I hope you're learning a lot. And I'll see you in the next video. Thank you!